Sa bheith léibhar maidin leis an stratéis seo cheola agus le tréasú léamh as an obairtáisiúla goibh ní amháin go ginearáltaach ar an gá lá iniu agus amárach obair an hÓgartaigh roimh agus tá an bhuaictí bheas feithin seo. I'm delighted to be here for a number of reasons, but particularly delighted. Martina mentioned the starting with why, and I remember when I came here first in this hall when we talked about launching the strategy and the strategic conversation at the University of Galway. I mentioned what I think is the best book I ever read on strategy, which is by Simon Sinek, whose name is Start With Why, whose title is Start With Why. And I think in particularly pleased that this strategy starts with why. And when we ask that particular profound question, why are we here? It's a very beginning of a very profound conversation, particularly in medicine, nursing and health sciences. And I'm particularly pleased that in the context of this strategy launch, the next couple of days ahead of us, that there's that sense of finding out and sensing why we are here. And when you do that, you wonder, what are the needs? So why are we needed? What are the needs we have in the future? And the sense of future care, the sense of identifying, as Martin has said, what are the needs that we are addressing not only currently but in the future? That starts with why. And there are many ways in which colleagues here do fantastic work, starting with that very profound question of why we are here. And many of those are highlighted over the next few days. Public patient involvement, where we lead the way, funded by the HRB in a network nationally and internationally. Areas of how we shape our education, how we shape our research, the ICAT2 launch tomorrow, what our sense is of what the needs of the patient of the future is and what the needs of the region are. And I think, again, that's a particularly profound start, starting with why. And when we do that, the second lesson of Strategy 101 is when you make strategy, it's about making choices. So sometimes it means you do things, it also means you make choices sometimes not to do things. And I think those choices are also important and made here. And sometimes people can then say that because of that you're not entrepreneurial, you're not innovative, when you've just made different choices. And I think it's particularly important to encourage the college and colleagues here to think, once we start with why and identify those needs, that means we also make choices about what we do next to address those needs. And I think, again, in the strategy, if you read through it, and particularly the series of ambitions in page 10 onwards, there are particular choices made here that have very profound implications and very meaningful implications for patient care, for the region, for students, for research, and for colleagues more generally. And again, I applaud that sense of choices that are made based on the reasons why we are here. And I think in particular I'd like to, at this stage, commend the college and all our colleagues, not only in the college but in the healthcare ecosystem more generally. During the response to COVID, I think we particularly found why we are here. And that profound reflection, that profound reaction, that agility that we had, not only displayed that care and that focus on why we are here, but also showed an agility that we don't often recognise in ourselves, and certainly is often not recognised outside this institution. That we are a community that is capable of change, that we are a community that's capable of making choices, that we are a community that's able to identify why we are here and respond accordingly. And the third thing that happens in that context, so we start with why, we make choices. We also then identify that other sentence that's particularly important in our strategic plan as a university, that's also here addressed in the college, is we are here for the public good. And again, none more so than in this college, we are here for the public good. And very often when we talked about this, and there was a discussion about it in the consultation around the strategy, people said, well, that's, of course, it's taken for granted, or what does it mean? But very often universities are not seen as much as we should be, as much as we are, for the public good. I was at a debate up in Coram and ILAS about 2 weeks ago about impact on policy and on policy making. And the point was made very clearly that the taxpayer pays for what we do, and the taxpayer often doesn't see the consequences of what we do. And again, in this strategy, it is very clear that in educating the students and the medical professionals of the future, we are for the public good. In serving our region as we do, and as is very clearly stated in this plan, we are for the public good. And doing innovative research that has regional impact but is also internationally ambitious, we are for the public good. And I commend the plan for all of that, for starting with why we are here, making choices based on that, but most of all being for the public good. And I'm particularly pleased to be followed by a student, Dara. It was said by one of Martin's colleagues to me once that students are particularly important to us in this college, because not only because they're the future for society, but sometime in the future they may well be caring for us. But we also said in our strategy, not only are we here for the public good, but we're also here for our students. And ultimately we're here for people, students, staff, patients, the public, the region. And I'm particularly pleased to be followed therefore by a student, and we're headlining the role of our students in this university and in this college, because we are here also for our students. Tréithlim le bhillig, maithé seo, lá iontaige seo den coláiste, ach ní bhain de coláisteach den ollscoil uilig freisin, agus tréithlim leis an obair. Go mín agah. Thank you.